from speaking up and speaking out about issues that what that matter to people with IDD. Christine partnered with her co-workers of Ninth Oregon Center, along with leaders from across Ohio and the nation, to ensure people with IDD were included in the COVID response, and that people with IDD were given a chance to communicate with leaders and their experiences during the pandemic. Christine worked with Jeff Davis, a director of Ohio Department of Developmental Disabilities, to make sure advocates' voices were heard. Let's hear from Christine and Jeff.
I was first the self-advocate trainee in 2016 to 2017 in LEND, which stands for Leadership, Education, and Neurodevelopmental Disabilities. I am a clinical research assistant and self-advocate faculty. The changes that I experienced when I was in the COVID-19 pandemic that we still are in, hit by having reduced level of staffing, more remote support, and staying in the house, and less active because we can't go as many places as before. We wanted to make a survey because the Ohio Department of Health was doing a COVID-19 survey for seeing how other Ohioans were doing it, dealing with the pandemic, but they didn't focus on the disability community. And we wanted to focus on the disability community, especially individuals with intellectual and developmental disabilities. And individuals with intellectual and developmental disabilities are often left out of research and not given the opportunity to answer questions for themselves. We know that we can learn so much by listening directly to our stakeholders. They are able to tell us how to know how the pandemic is affecting their personal lives better than someone else, because the individual is the one experiencing this. And we want to hear what everyone has to say and how could we make the services even better during this time. The partners who we sent out the notification for the survey included the Ohio Department of DD, Ohio Self-Determination Association, Franklin County Board of Developmental Disabilities, Ohio Association of County Boards of DD, AUCD, which stands for Association of University Centers of Excellence in Neurodevelopmental Disabilities, which the Ohio State University Nisonger Center is part of. We adapted and modified some questions from an existing survey called the Pandemic Impacts Inventory from Dr. Daminon, D-A-M-I-O-N, Grasso. Our team also worked with our partners to come up with questions across different areas, including disability services, healthcare, mental health, employment, and technology use. Our partners helped us distribute the survey linked through email listservs and by posting it on social media. About 400 people completed the survey, including 181 individuals who reported having a job before COVID-19. Unfortunately, 50% of those employed before the pandemic were laid off. Alarmingly, 50% of all participants reported having more mental health problems since the pandemic, including being worried, 70%, stressed, 66%, and sad, 56% were the top three. Only 60% of participants reported knowing what to do if they were exposed to the virus. Health and public safety information needs to be made accessible in clear language and distributed through an extensive network with the help of partners, including state and local provider agencies and self-advocacy groups. I can also say that with this, we really have learned how people feel in their in how technology for internet access has been a hot topic during this pandemic, because when now everything is going virtual, in doing doctor's appointments virtually and doing a lot of other things virtually, even like your counseling or your psychiatrist if you just need refills and nobody needs to really see them physically. We also learned that there was some other people who live in an ICF, and that's an intermediate care facility, and when doing the doctor virtually, their anxiety levels and stuff goes down because they're not having to leave their house and going out of their environment, like going to the hospital or somewhere. They get to do it virtually. But there's always a little bit of challenge where, what if the family or individuals don't have internet coverage? What about those folks? They have to still do stuff physically. So that was a very big hot topic, internet coverage as a way for the way people with social distancing. Internet coverage is a hot topic right now. Well, the one thing to tell you is we're all in this together to fight and see that we get everyone's needs met. We want to see everyone have equal choice and rights to do things for what they want to do. And we have some concerns that there are chances that some individuals with intellectual and developmental disabilities are not getting the treatment for COVID-19 versus someone who has like insurance, and that's something we fight on to say that's not fair, because everyone is American citizen and deserves fair treatment.
So my assumption is our experience with COVID is similar to other states. It's been a journey in many ways, from initial recognition and a sort of blanket stay at home, and people had to adjust that way, to one where people are more accustomed to living in a virus environment, but it brings with it its own challenges. And I think we're in that period now in Ohio, at least, where you can feel the exhaustion and the fatigue. And there have been so many remarkable stories with our DSPs and with collaboration with our counties, and sort of that ramp up led people to the energy that accompanied a fight. And now over a prolonged period of time, you can feel the effects of just that extended battle with a virus of the nature that we have. And so we are feeling that fatigue and that exhaustion, and you have to continue to find ways to nurture and support, you hope, and the relationships help, which we'll talk about, but we're in that stage where it's just a recognition that this is ongoing and that you have to be diligent and you have to take advantage of all the strengths inherent in your system. And I want to say this up front. I'm sure everyone, that listens to this has an advocate or advocates throughout their self-advocates, if we like, throughout their system that are just absolutely remarkable. And Christine Brown is one of those for us. She is absolutely tireless in her efforts on behalf of the individuals that we support. So that's a real advantage. And with that energy that Christine brings continually, sort of forces us to, hey, let's do this. We have had a wonderful partnership with the Nice Honors Center. They're affiliated with Ohio State. As you said, but we've used them and worked with them, contracted with them in a number of different ways over the years. They were intimate with us on our efforts around remote supports and planning for the future. So we know them well, we're comfortable with them, and hopefully it's vice versa. We lean on one another, and I think that strength, has played itself out in this rather creative approach to talking to people during the virus and getting their experience. Obviously we will help where we can, and we've got talent in this department, and they were part of the effort in working with them and fashioning the questions and different things, but I don't by any stretch want to take the spotlight away from Christine and the Nice Honor Center, because they carried it out. And so what I would say, and I guess I don't know this, but it feels like it's a unique idea. And I think the personal nature, sort of that on-the-ground nature with Christine and her relationships with other self-advocates and also with the Nice Honor Center allowed us to get a pretty good response to that survey. But it was just that I want to hear from you. This is the way they did. Tell us how you're doing. Tell us how this the virus and then the environment that the virus has created. Tell us how you're feeling. Tell us how you're doing. And so I think there are some really good things coming out of that, and some of them are striking. The piece about employment, I think we had a sense, but we had a number of individuals that were competitively employed. I think we were down to about 50% that lost their work. Some are coming back. We're watching that very closely. That's a good thing, but that's a harsh impact, like it is throughout the entire community, our entire communities everywhere. And then also the number, and this probably reinforces what all of us intuitively know, over time, the environment itself, the anxiety that accompanies, the virus and all the changes that happen result in mental health issues. We know this. We know this for everyone, but it is for obviously those that we support as well. So we are seeing more anxiety, more sadness or depression, a number of things. So we have to be particularly careful around that and see what we can do, again, to just keep our finger on the pulse to the best that we can with our partners, our providers. We have county boards, developmental disabilities in Ohio, so it's our responsibility to do what we can with what we know, and assist people as we move into the continued phases of this environment until we're out. We try. I would give us and certainly our communications individuals. Stephen is listening, and just an A+ for the amount of information that they put up so much early on. I think we revised something along the lines of 30 administrative rules. It was just constant, and then guidelines, and people ask for them. But it's simpler to do that, isn't it, in among professional partners in your system. It's harder sometimes to get at, to the individuals themselves for one reason or another. So I would just say, and if others have magic answers, I think you're always working at that. I think that was one of the reasons why we were so impressed by the survey effort, is it targeted that audience and went directly there. But we do, and just to answer, we try in a number of different ways, but I think you're always trying. I feel like our system, I've been a part of our system, intimate to it since 1991, which shows my age, but we've gone through different stages, and I'm sure, like others, you've had, and I'll speak to the professional pieces of it at this point. You had different times where the relationships were good. Sometimes they weren't so good. Sometimes they were really awful, depending on issues. And you've been through all that. But I think the virus has shown us that we are one family, all of us. And I've been remarkably impressed with the way that people have worked together. There's never going to be continuing unanimous agreement, but there has been a real desire to partner. There's been a real desire to work together. I think here in Ohio that has shown itself. I couldn't be more appreciative for the relationships that have been built during this environment, the way that people have tried to help one another. The people have really bellied up to the I won't say to the bar, but they bellied up and worked at it, and it's been exceptionally hard in so many ways, but people have tried, and I'm hoping that is lasting, that whatever remaining legs of the journey we have with this virus environment as we move our way out of it, I hope what sustains is the fact that we know we're better when everybody works together. I want to thank you, and all of the team at Nasty's for helping us put this story out there. I think it's not just a nice one because of the effort and the target, but the way that it turned out, we learned a lot. And so there's no reason that we won't do this again and again here in Ohio to see exactly, where people are, how they're feeling, and what kinds of things we need to do to adapt. So thank you very, very much.
I found stuff is to my